Erica, I'm going to be your nurse today. I'm just going to quick wash my hands. Hi, I'm Erica. I'm going to be your nurse today. Can I get your name and date of birth? Okay, wonderful. I was looking in your chart, and the physician has you ordered to have a dry dressing, and I noticed that it's time for us to do that. Are you in any pain right now on a scale from 0 to 10? 0 being no pain, 10 being a lot. Like a 7? Okay, I'm going to give you some pain medication, and then I'll come back in 30 minutes, and then we'll change your dressing, okay? So now I would do med administration and make sure to record that. And after administering it, I would wait 30 minutes, and now I'm coming back. Okay, I washed my hands again, and I think we're ready to do your wound dressing. What would you rate your pain at now? Like a 2? Okay, great. I'm going to raise the bed up. Alright, I'm going to pull the blankets back. And raise your gown up, okay? Alright. That's good. I'm just going to set my supplies up. And all this stuff would be wrapped, but of course we don't have that. I don't not touch my. I'm gonna put on clean gloves. Alright. Are you comfortable? Yes? Okay. Let's slowly peel off the dressing, a little bit at a time, and peel it back. And take a look at the drainage that's on the bandage and measure it and record. I would assess the wound bed and take a look. Notice any malodors or any serosanguinous drainage or anything like that, anything that could be a possible change. Then I would dispose of everything, put it in there. Okay, then I would do hand hygiene again. Then I would come back and put on my sterile glove. And I would make sure to ask the patient if she was allergic to any medications or had an allergy to latex or anything. And normally this glove wouldn't be folded up like this, but I will try to get my fingers under it. It's not really working, but we'll try. It's kind of stuck together. This is technically breaking sterile technique because I can't get it on. But just kind of go with it. Get my fingers under here. Okay. I would take one of my swab sticks and measure the length of the wound. This would be after cleaning the wound, of course. So we're going to assume I did that. So then I would measure the length and the width of the wound, go down into the depth of the wound and measure that. Then I would check for any tunneling along the edges. Then I would dispose of this. I would dispose of my gloves. Go do hand hygiene. And that. After doing hand hygiene, and go get some clean gloves. clean gloves. Now I would take my
Almost sneezed.
And make sure not to go above the depth of the wound bed. Of course, this would pack a lot easier on a real person. And make sure not to push it in too much on the edges because that can cause tunneling. Okay. I would take gauze. And normally I would have pre-ripped a piece of tape like this. But I did not. Can you rip this one?
Mm-hmm.
So then I would put this piece of tape along the edges, and I would put another piece of tape along the edges like that, and then two right there. I would ask her if she was in any pain. Pull her gown down, pull the bed sheets back up, dispose of all of my materials. See if she's comfortable after raising the bedroom. And I would make sure she's in a comfortable position. I already checked her pain and I already did that. So then I would make sure to I would make sure to chart, you know, the change, the dressing, the amount of gauze and everything that I use, the type of dressing it is, and her reaction to it, and any change in the wound itself. In the future, when I'm changing when I'm checking the depth of the wound, I would then pack the wound with my sterile gloves. I wouldn't have taken them off yet and put on clean gloves. So that was my mistake. I just remembered that. So then after packing the wound with the other Q-tip, after measuring the depth, I would peel off my sterile gloves, wash my hands, put on clean gloves, and then cover it with gauze and do the tape and all of that. So I would then give her her call light, make sure that she asks me if she needs anything, and that would be it.